Senator Bernie Sanders, who lost his last bid for president, is now leading the polls in the packed field of 2020 Democratic candidates. Today, 4 of his opponents in that race are co-sponsoring his universal health care plan in the Senate. It is called Medicare for All. Ed O'Keefe spoke with the self-declared Democratic socialist in an interview you'll see only on CBS This Morning. Ed, good morning.
Good morning, Nora. These days, you're more likely to see Senator Sanders out on the campaign trail than here in the halls of Congress. But he's back today to introduce an updated version of one of his signature proposals. Long considered too radical by many Democrats, it's now central to how the party talks about health care.
We have a chance for Medicare for all.
It's a common refrain of the Democratic presidential campaign.
I believe in Medicare for all.
And that is why I'm supporting Medicare for all.
I support Medicare for all.
But what is Medicare for all?
It guarantees, like every other major country on earth, health care to every man, woman, and child in this country.
Is this proposal socialism?
No, actually it is not. It's similar to what the Canadians have.
Under the Sanders plan, all Americans would be covered by a government-backed program like Medicare. All necessary health care would be covered, but at a cost. Some put the price tag at $25 to $32 trillion over the next decade. This sounds expensive.
What's expensive and what's unsustainable is the current healthcare system.
And what if I have a private or employer-based insurance program right now and I like it?
Well, you may be one of the millions of people who leaves your job this year and you're going to leave your private insurance. You may be one of the many millions of people who finds that their employer has gone out and got another insurance company to cover you. You're going to have to change that. But essentially, under Medicare for all people will be covered by Medicare.
And what happens to those insurance companies after your plan is implemented?
Under Medicare for all, we cover all basic health care needs, so they're not going to be there to do that. I suppose if you want to make yourself look a little bit more beautiful, you want to work on that nose, your ears, they can do that.
So basically, Blue Cross Blue Shield would be reduced to nose jobs?
Something like that.
The senator's bold proposal doesn't account for the thousands of people who work for those insurance companies and what would happen to them under his plan. We reached out to Blue Cross Blue Shield for comment, but didn't hear back. Anthony?
Yeah, thanks. I think everybody wants to see a better health care system. The question is, how do we get there?